Hello friends, welcome to my channel Level Up Pharmacology. Now in this video, I am going to discuss about diuretics. These are the drugs which are used in many conditions like congestive heart failure, pulmonary edema, systemic edema, and also in the hypertension. By the use of these drugs, we can lower the blood volume by increasing the urine output, and by lowering the blood volume we can reduce the blood pressure also. To understand about diuretics, first we have to understand about the basic functions of the nephron and how the nephron will reabsorb electrolytes, water. Then only we can understand how the diuretics will work. Let's get into detail. Diuretics. Diuretics are the drugs which results in diuresis. Diuresis means di means double, uresis means excretion of urine. Diuretics are the drugs which doubles the excretion of urine. Diuretics are the drugs that promotes the excretion of sodium and water from the body, or it increases the net loss of sodium and water from the body by inhibiting reabsorption of sodium molecules. These drugs will inhibit the reabsorption of sodium molecules, so the sodium molecules will excrete in urine. As we know that water will follow the sodium molecules, so more amount of water appears in the urine. These are also called as water pills because diuretics will promote excess water loss in urine. We should also know about natriuretics. The term natriuretic means these are the agents which promotes the net loss of sodium molecules, specifically sodium molecules in the urine. As we know that the water will follow the sodium, that leads to diuresis. Natriuretics and diuretics will result in diuresis. Nephron. It is the basic structural and functional unit of kidney. It is very important that it will purifies the blood and it will excrete the waste products like uric acid and creatinine, etc., and it will preserve or it will reabsorb the important useful molecules like urea, sodium molecules, chlorine, water, magnesium and calcium molecules. It will reabsorb them back into blood. The nephron has different parts. Those are Bowman's capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule and collecting duct. The blood from the efferent arteriole enters into the Bowman's capsule. Here there is a tough capillaries called glomerulus, and it leaves the glomerulus by efferent arteriole, and this efferent arteriole will surrounds the nephron at different tubules, and then it leaves by venules. Here the blood will be filtered out. Approximately 16 to 20% of the blood entering the kidney is filtered into the Bowman's capsule via glomerular capillary. The filtered blood is free of plasma proteins, WBC, RBC and platelets. Here the large molecular size like RBC, WBC, platelets, they cannot be filtered, and the small molecular weights like glucose molecules, sodium molecules, potassium molecules, calcium, chlorine and bicarbonate ions will filter here. The filtered blood will travel through the renal tubule, enters into the proximal convoluted tubule. Here, most of the molecules like sodium, chlorine and water molecules will be reabsorbed back into the blood. Not only this, sodium, chlorine and water, amino acids, glucose, bicarbonates, all lower molecular weights are reabsorbed into the blood. After that, the filtrate is moved into the loop of Henle. The name loop of Henle comes from, it looks like hairpin shape. Loop of Henle has two parts, thin descending limb loop of Henle and a thick ascending limb loop of Henle. When the fluid moves in thin descending way, the tubule, this renal tubule is permeable to water but impermeable to sodium. The sodium molecules will stay here only, water molecules will leave the tubule and enters into the bloodstream. So the filtered fluid gets more concentrated, and when the fluid is moving through thick ascending limb, here opposite takes place. When the fluid moves in thick ascending limb of loop of Henle in this way, here it is impermeable to water. Water cannot be reabsorbed into the bloodstream, and it is permeable to ions like sodium, chloride, potassium, magnesium and calcium. As the fluid loses these molecules, it gets hypotonic and it moves to distal convoluted tubule. Here in the DCT, sodium and chloride molecules will get reabsorbed into the bloodstream. Under the influence of parathyroid hormone, the calcium molecules are also be reabsorbed into the bloodstream. So after this, the fluid will enters into the collecting duct. In the collecting duct, there are two types of cells. One is principal and intercalated cells. Here, under the influence of aldosterone, the sodium molecules are reabsorbed from the collecting duct, and potassium and hydrogen ions are secreted into the collecting duct. Here, the body doesn't want to lose sodium molecules in the presence of aldosterone. By the aldosterone, sodium molecules are reabsorbed into the blood and potassium and hydrogen ions are secreted into the lumen. And by the influence of ADH, antidiuretic hormone, in collecting duct, the water is reabsorbed into the bloodstream, H2O, water. And the urea will follow the water. Urea also reabsorbed into the bloodstream. So the urine, here the remaining fluid will be more concentrated, and the remaining fluid is the urine. This is the urine. Here the fluid filtered from the glomerulus is glomerular filtrate, and the glomerular GFR, glomerular filtration rate, is 120 ml per minute. But after all these reabsorption and secretion process, the final output of urine is just 1 ml per minute. The body doesn't want to lose much water. Important molecules like sodium, chloride, potassium, magnesium, calcium, it doesn't want to lose, so it will reabsorb these molecules back into the blood. Guys, now I will tell briefly about diuretics, how they work. Here, as you see that major amount of sodium, chloride is reabsorbing in different parts of the nephron, like PCT, DCT and the loop of Henle. Diuretics will block the reabsorption of sodium molecules from the renal tubule into the blood. So the sodium molecules will stay in the renal tubule. They will not enter into the bloodstream. As we know that water loves to follow the sodium molecules, water will also be retained in the lumen. So ultimately more water is excreted in the form of urine. The main goal of diuretics are to increase the urine production, to increase the amount of water in urine. It results in excretion of more water from the body into the urine. So ultimately the blood level, the blood volume will get reduced. Whenever the blood volume will get reduced, it will helpful to treat some conditions like pulmonary edema, CHF, hypertension. There are different classes of diuretics which works on different parts of the nephron, like carbonic anhydrase inhibitors will work on the proximal convoluted tubule, and loop diuretics will work on loop of Henle. Here in this part, early part of the thick ascending limb, and thiazide diuretics will work on the distal convoluted tubule, and potassium sparing diuretics will work on the collecting duct. Osmotic diuretics will work all over the body. Up to now, I have discussed about introduction to diuretics and how the nephron will reabsorb electrolytes and water into the bloodstream. In my upcoming videos, I will discuss about how different types of diuretics will work. Example, carbonic anhydrase inhibitors, thiazide diuretics, loop diuretics, and potassium sparing diuretics, and also osmotic diuretics. If you like my video, please subscribe to my channel. Thank you.